this did gain a lot of attention after Matthew Perry died. Do you remember this? So he was in his hot tub, but it later came out that he OD'd, and they found like a way too high of amount of ketamine in his system when they performed the autopsy. So this is, I mean, it's serious stuff. These are the clinics that are administering ketamine are
controlled environments.
Yes, thank you.
And they do it in a safe manner, from what we understand.
And you are under the supervision of medical professionals. So and I know it does get prescribed from time to time as well. Here's Dr. Eloge.
Hi, doctor. Can you hear us?
Hey, good morning. Yes.
Hi, good morning. Okay, so what is your title exactly?
I am the Associate Director of the Women's Board Depression Treatment Center at Rush, an assistant professor there in the Department of Psychiatry.
Beautiful. Okay, so let's get into it. Anthony is quite passionate about this topic, so we'll let him ask the first question and get us started.
Yes, for sure. First of all, Caitlin alluded to the fact that it's becoming mainstream. Where are we in that? I know that there's like clinical trials that need to happen before this stuff is approved to be used to treat folks who are suffering from mental health issues. But kind of where are we in the mainstream or standardization of this as a mental health treatment?
Yeah, that's a really great question. So it's part of my job at Rush was being involved as an investigator in some of those trials, those clinical trials that led to the FDA approval for S-ketamine, a type of ketamine for treatment-resistant depression. So in depression, if you try the typical first-line antidepressants, the kind of like oral medications, and you don't really have a good response, that's a really good time to start thinking about other novel treatments, and ketamine is one of those that's coming out. So it's important to differentiate how there's the S-ketamine part, which has the clinical trials and the FDA approval, meaning there was some amount of research that led to that, and then also the ketamine clinics via IV or oral. There's a bunch of different ways that you can do it that are also out there that seem to also be quite effective.
What is ketamine? What is it made from?
Ketamine is actually a medication that anesthesiologists have been using for 50 years or so for anesthesiology, for surgeries. But really interestingly, about a decade ago or so, we found that when we change the dose, we do a lower dose, it seems to be effective for depression. And that's because ketamine is unique in its ability to, in the brain, there's these neurons, these cells that communicate to one another, and it's able to release glutamate, which is this neurotransmitter. It's this important substance that lets the neurons talk and activate and kind of wire together and develop new connections. So we think that that's why ketamine is important in depression.
So is it a single dose that makes a difference for these patients that have treatment-resistant depression? Is it a series of doses? And is it coupled with talk therapy as well?
Yeah, I would say that the best thing that we know is from the research. And the research has shown that ketamine treatment that's delivered a couple times a week for several weeks seems to be the most effective way to get some response. Now, there certainly have been some folks who have had a really wonderful response after just a couple of treatments. But if somebody's kind of interested in going forward with a treatment like that, working with it for several weeks really is the best way to do it. The question about therapy is really, really fascinating. So there are many places that are doing kind of like ketamine-assisted psychotherapy. And I think if you look back a little bit, in depression treatment, we know that therapy is effective, and we know that medications are effective. And we actually know that both of them together have this synergistic response. People have even better results when you do both of it together. And then I think that that's kind of the idea here with ketamine is if we can have therapy get a boost with the medicines, if those can work really well together, maybe they could have even more of a response. We are seeing that some of these treatment centers are having some really good results when pairing the ketamine with therapy.
So we're seeing here that the secret lives of Mormon wives, so they've used ketamine to work through emotional trauma, and you were describing how it works, how the synapses in your brain connect in different ways that aren't happening without the ketamine. So once they connect and your brain is, for lack of better, I don't know what I'm talking about exactly, correct me if I'm wrong, working in ways that it wasn't before, does it fix it? So Anthony was asking, like, can you do like a one and done treatment? Like maybe you work through that emotional trauma with this one experience, the brain is communicating in a way that it didn't before, and then you walk out and you're healed? Is that what this is? Or is this more of like you're mentioning it's a medication, so it's more of like a depression medication that you have to continue to take as like a prescription and you have to come back?
So I think this is a really interesting question. I would say that we're talking a little bit about two things. We're talking about depression treatment, and there I think the research is pretty clear that we need to continue on the treatment, and that's going to need to be recurring, much like many other treatments we have in psychiatry. Maybe some changes in kind of like spacing it out and whatnot might be available, but in that area, we do know that we need to continue on, and the risk of falling back into a depressive episode if somebody stops the ketamine treatment is unfortunately quite high.
Okay.
Can you give
and then on the other side, this other question that I think this clip highlights that's really interesting is more of like maybe wellness, or what if I can understand myself a little bit better. Some of the trauma work I think is a little bit less known, I would say, from the research perspective. So maybe there might be other protocols that might be not as enduring or repetitive that might be useful, but that's still a little bit unknown.
Dr. Eloge, can you give us an idea of what the patient actually experiences during the treatment itself?
Yes.
I remember I did a longer form story. This was a few years ago. It was so cool, though. I talked to a man who was a self-described alcoholic to the point where he was drinking like 25 drinks in one sitting. And I remember he told me, this is wild, but he'd be like, when I knew I was going to drink, I would take the Monday, the following Monday off of work because I know I'd be nursing like a 2-day hangover.
Wow.
So his doctor basically said, if you don't stop drinking, you are going to die. So he did a clinical trial at NYU involving psilocybin, and he actually had what I would describe as a mystical experience during one of his sessions, and it was a visual experience that he had, and he is not, this was 5 years after his drinking, but he said, I have not touched a drop of alcohol since that experience. Are ketamine patients experiencing similar things, or is the inpatient, in-clinic experience different than that?
Such a powerful story, Anthony. Thank you for that.
Sure.
So I mentioned that our group at Rush has been doing research in ketamine for a while now. That's been really interesting. And over the past a little over a year, we've also been doing clinical trials with psilocybin for depression. They've been really fascinating too. And so I would say that the experience is different. Ketamine has a bit more of sedation, bit more dissociation, feeling kind of disconnected from your body, maybe feeling like time kind of moves a little bit differently. And the duration is shorter. Ketamine tends to have those acute effects being for about an hour or so. Conversely, the psilocybin study that we are currently running seems to have more of what you mentioned, maybe some visual distortions, maybe some changes in kind of perceptions and how you like hear music, less maybe of the sedation, and then a little bit longer, so it seems, of an effect, lasting more like folks are hanging out with us in the clinic for about 6 hours on those sessions.
So for those who are, I know with some of these psychoactive, I don't even know if that's what this is considered, drugs, something can be triggered in your brain and you might have issues afterwards mentally.
Not come back.
Something could be, yeah. So for people who are concerned about that, like I don't want to take this trip and take these drugs and then on the other side be forever changed in a negative way, what do you say to those people? What have your studies shown about that?
Yeah. So both medicines, ketamine and psilocybin, have a history of abuse and recreational use outside of medicine. And so we've learned a lot from those studies where there can be some unintended side effects, and then it's like, well, why? Maybe is it the setting? Is it the kind of like wrong person who should be using something like, because of maybe some risk factors that put them at a higher risk of some of those things that you mentioned? And so I think it does really suggest that we should be looking at these potential treatments in a supervised setting with medical professionals, and to be able to look at who might be a good candidate and who might not because of some of those risk factors I was just mentioning. And also to monitor for safety, for changes in blood pressure, changes in some of these side effects, making sure they go away before folks are discharged from the clinic. All those safety pieces are quite important. In our clinical trials, we've not had those kind of prolonged negative side effects in ketamine. And while we're still working through the psilocybin study, I guess I would say earlier phase 2 studies have all had some pretty reassuring data that long-term consequences like what we've heard in the community don't seem to be as common.
I just wanted to ask a question. So do you think that there is, or do you know if there is, like with people, you have something you're born with, like in your biology that could trigger something like schizophrenia if you do take these kinds of drugs? Do you know what I'm saying? Like something that
like
just
genetically
happens.
predisposed to like a psychosis.
Yeah, like is there a way to test for that before you take these drugs?
There's not a great reliable like blood test to see if there's some sort of risk factors. This is an active area of research, and we are finding that there are some specific genetic markers that seem to increase the risk of some of these unintended side effects. So hopefully in the future we'll have a little bit more specificity there.
Yeah.
But as of now, we know that there's something genetically linking some of these disorders, including schizophrenia, bipolar disorder, depression, many of the things that we have in psychiatry. But it's still difficult to identify specifically where those are coming from, like in terms of looking at the whole genetic signature. And so I hope that we get one day a little bit more specific information to guide those kinds of treatments to look a little bit closer. But as of now, it's really primarily through meeting with psychiatrists, with a medical professional, and going through some of those potential risk factors and kind of doing it that way.
We're getting the wrap, Dr. Eloge, but one more question before we let you go, and that is, if someone catches this interview who does have that treatment-resistant depression and they are interested in this kind of treatment, what would be your advice?
I would say that in terms of ketamine, there are many clinics out there. I would say that the S-ketamine version is the one that has the FDA approval, which is really wonderful because there's lots of reassuring data in terms of safety and efficacy, and the way that clinics that are certified to use that medicine have to have certain parameters set up. So I would encourage considering going forward with one of those treatments. The alternative, these IV ketamine centers or some of the other ones, also really lots of potential out there for those. I would suggest looking for these centers who you're meeting with a medical professional, have really good supervision, those sorts of things. And then, of course, we continue to do these clinical trials at Rush, looking at folks who are, not having the response to the typical antidepressants that are so common in the community. And so if you're interested in that, reaching out to our center to see if you might be a good fit for one of our trials on some of the stuff that's new and coming out might be a good option.
Really
Wonderful.
Fascinating. All right, Dr. Josh Eloge from Rush University Medical Center. Thank you so much for your time this afternoon, sir, or this morning, I should say. We appreciate it.
Oh, my pleasure. Yeah, thanks for having me. Thanks.
All right.